Options for people escaping domestic violence are limited, with rentals often too expensive and few places available in social housing.
It's leaving homeless shelters with an impossible task, deciding who gets accommodation when so many people are in need. It's also leaving many women and children with nowhere to go. Joining us now is the CEO of Ann Rose, Tessa Boyd-Kane. Tessa, thanks for coming in this morning. Give us a sense of the scale of this problem at the moment.
Well, the official data tell us that 120,000 people across Australia will be homeless not on any given night. But this is about more than having a roof over your head. So when we hear from services, they report that of people experiencing domestic and family violence, almost over 104,000 are turning to them for help. And then we see also that many women are not able to leave unsafe homes because of financial insecurity, and many women return to those homes again because they don't have that secure housing that is really critical to keeping them safe.
How are decisions made around who gets shelter when so many people are in need?
Well, the connection between safe, available and affordable housing and safety is crystal clear in the evidence, and that's recognised in the National Plan to End Violence Against Women and Children. But there's a whole range of contributing factors here that shape that experience for the particularly women and children that we're talking about. So we know that it's both that financial security, again critical to housing, but also factors like health, and particularly thinking about mental health, both the stress and anxiety that often exacerbate experiences of safety in the home, but also are a result from it. And then there's often legal issues. So we might be talking about families that are going through family court proceedings where custody is a factor. So the choice, such as it might be to leave a home, is often really constrained by other factors.
And what happens to someone if they are turned away from a homeless shelter? What happens then?
Well, we're talking about huge numbers of people who are being turned away, and then they're being turned away in different circumstances. So we see that about a quarter of people who are seeking help for short-term and crisis accommodation are being turned away. More than 50% of people who are seeking medium-term housing are being turned away, and a shocking something like 70% of people who are seeking long-term housing are being turned away. Now, again, remembering that this is mostly women and children affected, we know that women are using their existing networks. They might be couch surfing, staying with friends and family, but many people will be using cars or, what are very temporary and equally unsafe options in terms of where they sleep.
It's a complex problem, obviously, but what needs to be done to help this situation?
Well, complex is right, and the first thing to recognise is that while everyone needs to play a role, there's no one service area or solution to this problem. So homelessness services need to be well funded. We need adequate housing options in both those short-term or crisis, medium and long-term scenarios, but we also need to be thinking about financial support. We need to be thinking about flexible employment. We need to be making sure that every part of government is working together around these services. And then at the individual level, we all play a role. We need to be able to ask people if they're safe at home, to be able to hear what they need, and to be able to provide them with the support as and when they seek it.
Are you seeing progress in those areas, or are there particular areas where you're seeing at least some progress?
We've seen a real recognition of these interacting factors. So, as you said, it's complex. That is being increasingly understood. But at the same time, we are seeing really significant increases in the problem itself. So, in the 5 years to 2021, there was a 10% increase in women experiencing homelessness in this context of family violence, compared to 2% affecting men. I think one of the things we're starting to understand is that much as we need services and responses to women and children who are experiencing family violence, we need to understand how to stop the mostly men who are using it. So we're starting to see research focus much more clearly on people who are using violence and what it's going to take to stop that.
If you or anyone you know was affected by this video, please contact Lifeline on 13 11 14 or 1-800-RESPECT, 1-800-737-732.